Yeah.
Okay, good. So lower back spinal stretches, yes? So as I've said, lower back is one of the most common problem that people have in our society. Most problem that comes to physio, to massage, to GP, and most of the tissue that cause the pain are muscles, and they're responding to relaxation quite well. Yeah. So we have two ways to help them. First, general relaxation, and then muscle stretches. We have other things by petrissage and effleurage. You can increase the blood circulation there. Okay, fantastic. So first of all, few things that can help people with lower back pain. You must put a pillow underneath there. Yeah, because why? Because it relaxes the lower back. Yeah, so remember that. Okay, so just for now, we'll put that. You need to put two, and sometimes quite high to decompress the back, to make it easier. Okay, the first thing that you can do is you can do stretches with the legs. So actually, by stretching the leg this way, which muscle do I stretch on the lower back? Quadratus lumbarum and little bit the rectus spinae. Yes, the rectus spinae. Okay, so you can hold the leg this way, and then you can stretch it. Now you need to confirm that kind of. Do you feel the stretch?
Mm-hmm. Yeah.
Yeah, good. You can, and then you can leave it. You can oscillate that a little bit. If I want to stretch it further, I would move to here. Yeah, I will move to here, and then stretch it with a little bit of rotation. Do you see?
Mm-hmm.
Do you feel it more?
Mm-hmm. Yeah.
Yeah, good. Is it pleasant? Do you feel the nice stretch?
Yeah, feels good.
Yeah, good. Good. An alternative one. This is quite heavy. Could be, yeah. An alternative one. You do that. You put the leg this way, and you stretch the person that way. Yeah. So you need to maybe hold on to the. You see, leg onto here, and then you're stretching and massaging together. Do you feel less the stretch now or more? Or it's a different stretch? Maybe you feel it more in the hip.
Yeah,
You feel it more in the hip
and stuff.
and around there, okay? So this stretch would be good for gluteus muscles more, but also into here, yeah? So we have 3 stretches so far, yeah? Cool. Good. You can do another stretch by sitting this way and then leaning, yeah? Do you see how it will be easier for you to do? Yeah? Just be careful on the ankle. Don't hold the ankle, especially with people who have sprained ankle, because that is quite weaker, yeah? So hold it in a way that you're holding on the lower leg, yeah? And then stretch. Okay? You can do both legs. Okay? Both legs or this way. Okay? Stop the camera for a little while. Good?
Mm-hmm.
When the client lies facing down, one thing that tend to be that the lordosis here increases. And that's quite dangerous because it aggravates the muscles and the joint. So one thing that you can help them is to put a pillow underneath their abdomen. Yeah? And you imagine they're covered with it, and then you say, can you hold on your back up a little bit up, your abdomen, yes, and then come down. Okay? Of course, you still have to have the pillow here and on the ankles, but that by itself may help them to relax. Okay? Now, I don't know if you remember, but we did it on the first weekend, this kind of stretch.
Yeah.
You will.
Yeah. So you're holding and looking for the iliac crest of the hip bone and contacting the bone and then pressing. Is it too much?
No.
No? Do you actually feel? I'm not sure. And you have to be quite honest if you're effective. Is it more effective now?
Well, I can feel a lot of pressure on the hip, but I don't know if it...
You don't feel much on the... Yeah, me too. So, I can do it, but it actually doesn't work. So I need to find an alternative. Why? I don't know. I need to find alternatives, yeah? So I need to go back to the legs, yeah? Is it more effective now?
Yeah, it feels like it's in the spine. I can feel
Okay, that's good. Okay. So, back to the legs, okay? Sorry, one more turning around. I'm turning you around a lot.
Stop messing
Yeah,
about.
good.
We didn't turn it up.
Yeah. And that is an exercise and part of the treatment. I can do at the end of the treatment. I stand both legs. Can you stand the other leg as well? And then I ask them to come and hold on to your leg here and here. So it's nearly impossible to do it with towel. Yeah. This technique called the knee hugs. And they're hugging their knees, and by doing that, they stretching the lower back muscles. Yeah. Can you bring your knees closer to your chest? Both of them. Yeah. Do you feel the stretch in your lower back?
Mm-hmm.
So this is something you can do during the treatment if you have a carpet, better, or let them do it at home. And that would be really good first aid for them when it comes to lower back ache and even pain. Yeah? It's a good general exercise that stretch this muscle. So how to do that? You relax, and then you breathe in, and then breathe out, and bring your knees closer to your chest. Good. And then try to move a little bit to the right, very little, and a little bit to the left, and ask them to really feel like they're massaging their muscles. Otherwise they can attack the movement, okay? And then again, breathe in, and then slightly more. Good. That's it really, yeah? And alternative to that, you can do rotation. You know? You can ask them to do rotation. Simple. An alternative to that would be the exercise that they can kind of lie this way.
Child pose.
Yeah. So that would be again a nice stretch for the back. Should we give it a try? Yeah. Thank you.